just so I can get a general of my audience, and so I know to make sure, on certain slides, I didn't give you too much information, okay? So can you start this way? Yeah, just a little bit, your name, you from, what you do, a little bit.
Rick Bowie, Director of Clinical Engineering and Asset Management at Memorial Hermann in Houston. Been doing this for 30 years.
Awesome. Sir?
UCI, California. Data analyst, essentially.
Awesome. Got a lot of smart people in here, boy, I'm in trouble. Can I, yes, ma'am.
Nadia Al-Qaisi, I'm a environmental engineer for the National Program Office of the VA. So I'm in the cybersecurity layer. We're actually doing something similar to engineering.
Awesome. Yes, ma'am.
Felix Zuber, I'm a environmental engineer.
Great, sir.
Yeah, I thought the environment, but the state of the cybersecurity.
Awesome. Yes, sir. Yes, sir.
Gabriel Luque.
Just Molson St. Luke's Boise, Idaho. Program manager with a focus on cybersecurity.
Awesome. Yes, ma'am. That's beautiful. Yes, sir. Okay. I'll give you a minute to breathe. Yes, ma'am. Great. Yes, ma'am.
My name is Lauren Campbell. I'm a biomedical engineer at the VA.
VA, awesome. Yes, sir.
I'm Alan. I'm a one working for Hero Business over in Santa Ana, but I'm working over at Software Monster right now. I work with IT recently, so might as well have a better understanding of what they're actually talking about.
Yes. Yes, sir.
Technician.
Okay.
I'm an employee I'm the equipment distributor on yesterday.
Thank you. Yes, sir.
Patrick Kendrick, I'm a surgery partners. I'm the Director of Accreditation and Facility Services.
Yes. Yes, ma'am.
Tammy Kendrick, and I'm with Full-Time Medical Systems. We provide biomedical services nationwide, either with techs if you need extra hands or if you need a full service contract. We also provide cybersecurity solutions.
Beautiful. Yes, ma'am.
I'm Jennifer. I'm with Smith Memorial Engineers. I'm a biomedic.
Yes. Yes, sir.
Kevin Ross, Desco, working with Sharp on the program manager for cybersecurity.
Thank you. Good morning.
I'm Cecilia Garcias, and I am a biomedical tech for DRG Medical. I've been working for about almost a year. It's going to be a year in June.
Welcome to the party. You got a ride to go. Welcome. In my time?
You've got about 5 minutes. If you want to get started, I can kick it off.
You guys mind if I start early or if they're late? That's their fault. Anyway.
Be quick and easy. So just quick housekeeping notes. I think you guys are already familiar with it. Scanner, just scan it once either on your way in or way out. If you were to miss it, just we'll find right at the info desk. We've got sheets to go ahead and scan if you miss one. Without further ado, your speaker. I'll let you take the floor.
Thank you. Hi. We're going to torture you for a minute once you sit down so you can introduce yourself. Everybody got tortured, so I'm not just picking on you.
Okay. So, Mohammed, I work with Cal Providers in Northern California. Clinical engineer, been here for, been in the field for like 12 years. So my educational background is about engineering and microbiology.
Awesome. So, oh, we got 2 more. Can you scan your badge and then introduce yourself?
Christian Gonzalez, advisor.
Okay, biomed, IT. Welcome. So we have people that are 1 years and we have people that have, let's just say 15 plus years, okay? I won't, well, yeah, I'll talk about mine, I won't talk about yours. So my name is Almetha Ford. I'm so excited to be here. So if I get a little nervous, just ignore that. But I love to talk, so you'll probably get too much and not too little. How's that? Okay, I started out in biomed in '96. I was a student in Philadelphia area. I worked in New Jersey, Philadelphia, South Carolina, Georgia, Alaska, different hospitals. So I started as a biomed tech, went up to a supervisor. I was a clinical engineer for a couple of years in Virginia, forgot to add that. Then became a supervisor, director, worked as in IT as an analyst for medical devices, because I also understood networking. So then from there, because I was in IT, I was able to, and we had the medical devices, they started getting these fin tests. They didn't know what the heck to do with it. IT couldn't figure it out because it's medical devices. And biomed didn't know what it was about because it was software. We don't really deal with that too much. We deal with how it works, but we don't really deal with the nuts and bolts or your SBOMs. If anybody knows what SBOMs is, it's your software build of materials. All the ingredients it takes to bake the cake called your device, okay, software-wise. So since I was a senior analyst, I became the go-to and kind of led how we addressed all these vulnerabilities, talking to manufacturers who really had no clue what the heck we were talking about. So with these scans, and then moved on from there, decided I need to know more, went to college, got my master's degree in SCADA, industrial controls, and cybersecurity, and then I also do an extra 5 courses because I'm a certified project manager and got my master's in that. So from there, I've been working in cybersecurity for a health system. I was the only designated cybersecurity analyst, but they also had their own biomedical IT infrastructure, which to me is like the perfect scenario. But that's a whole nother, that's Atlantic Health. If you want to ask them about their program, Laura Stern, awesome program over there in New Jersey. So I did that for a while, and now I got hired to work with a consulting company called Tata. They're a global IT business, and they do work with manufacturers. So I work with Johnson & Johnson for the past 3 years, doing medical device cybersecurity and helping them get their medical device cybersecurity program up and going. The new FDA regulations is kind of tipping the OEMs on their heads. And I came in as a voice of the customer and kind of giving them my insight and stuff on the struggles that we have in our field, in our world. So that's my background. Any questions? No? Perfect. Okay. So let's go on. So we're going to talk about briefly, and I don't want to go deep because I can go deep, but we won't go deep. The FDA regulations, FDA updates in 2023. The Omnibus Bill. How many people have heard of the Omnibus Bill? That came in 2022. That forced manufacturers, as of 2023, to start rethinking how they're doing what they're doing and forcing them to partner with you guys to address the cybersecurity issues. The problem is we don't know that, and we need to know that. And I know I'm on the other side of the fence because I'm working with the manufacturers, but my 20 plus years in biomed, this is where my heart is. It's on the customer, it's on the patients, and on what we need to know to do better for our customers. Cybersecurity insurance. When I gave this speech, but this presentation 2 years ago, biomeds didn't even know that there was cybersecurity insurance and what it covers and what they need to look out for and incorporate in there. Service contracts, gaps and opportunities, and possible next steps. Okay. Come on, I'm clicking here. So the 2023 FDA updates, the scope of the guidance is applies to broad of all medical devices with cybersecurity considerations. So people will say, oh, this isn't a cybersecurity device, but if it connects to a network, your firewalls, all those things are connected and need to be incorporated in your consideration, your ecosystem for cybersecurity. Okay? So anything that's programmable or networkable, you need to make sure that that's incorporated. A lot of things get missed because it's not really considered something that's connected to the patient. Huh?
Even after check devices, equals meters.
Oh, that's biomed. That's cybersecurity. Yeah, all that. It's programmable. It's on the network. So if it falls in that bucket, that needs to be addressed. It needs to be looked at. Yes. Okay. And if you, and let me just say this in general, and it's not across all health systems, but when medical devices were put onto the hospital networks, they tend to be a flat network. So everything is here. The only thing that they do, a lot of places may do, is segmentation, which means you'll have a different segment for where all your medical devices go and stuff like that, but it's still on the same network. If someone can find what network on that same network and sit there for months or whatever, because if you read your paper to keep up with some of this cybersecurity stuff, people are sitting on your networks for months and not enacting anything until the right time. So they're only using segmentation. So if people can study your network and they have time, then they're going to do what they want to do. So it applies to devices that do not require pre-market submissions for the 510K. Example, your firewalls. Okay? Believe me, I'm going to be talking about firewalls because that's my pet peeve. They need to secure the development and framework. Manufacturers are recommended to address cybersecurity risk at each stage of the medical device development. This framework should be included in their security risk management plan. They are working on this as we speak. They're struggling with some of this as we speak. A lot of their devices are 10, 15, 20 years old, didn't have any of these in scope. How are they going to address it? These updates and the Omnibus Bill are only for devices that got approved 510K from 2023 and on. All your older devices are not included in this. It's called pre-Omnibus Bill. Okay? But because they have to come up with this anyway, they have to incorporate that with their other devices in some areas. Okay, we'll talk about that. Device labeling. I know some have seen that extra unique identifier code on the back of their devices that talk about the devices. That's kind of what the FDA requires that. I don't go deep into that. Come on. Let's talk about the Omnibus Bill. So according to this, manufacturers must plan to monitor, identify, and address post-market cybersecurity vulnerabilities and exploits. How many of you have had struggles with your manufacturer getting back to you on vulnerabilities that you guys have gotten hit with vulnerabilities? Okay, the new devices, they have to put this in plan, and they got to put it in plan really for everything, even back. Okay, they're working with the stuff that they have to get submitted, but if they're putting that plan in place, why would they put a different plan in place for the previous stuff, right? So they have to figure out how they're going to monitor. If they say we can't do it because it's Windows 7 and it's obsolete, then my next thing is do you have a firewall that's in front of it? Is that firewall still supported? That can help extend that life of that device, because now you're putting something to help protect that device, right? A little bit longer. So I would ask the questions, especially for your stuff that's no longer supported, okay, for the OS. They must submit a plan to coordinate vulnerability disclosures. So that's going to be helpful. And they must develop and maintain processes and procedures to provide reasonable assurance that the devices are related systems are cyber secure, which means moving forward, they got to incorporate, what do I love to talk about? Firewalls. They got to incorporate that where they didn't before. That was a throw and give, kick down the bucket to make you feel good. Now they can. It's part of your ecosystem. They have to do something about it, or at least say if they're not, and if they don't, what are you going to do? Ask them. Hello, what are we going to do about this? You must submit a plan to monitor and identify, address post-market cybersecurity vulnerabilities and exploits. They must submit a plan coordinated to their vulnerability disclosure and procedures. So they have to submit a plan. which means you can ask for their plan. How are they handling that? How are they handling their vulnerabilities? You can put that documentation in your asset management, right? So when you get asked about any of this, because we'll talk about insurance and stuff like that later, you'll have some of that information. Define and develop, okay. So we'll do that. We already talked about that. So you also have to make available post-market updates and patches to the devices related to the system on a reasonable and justified regular cycle, okay? And also as soon as possible out of cycle, critical vulnerabilities that should cause uncontrolled risks, okay? Which means they'll have a regular cycle, but let's say we have, what was that, blue, yeah, WannaCry, stuff like that. Then what is your plan to address those? You don't want to wait till 6-month PM cycle for them to address it. What is their plans? What do they have in their requirements for your new devices to address that? And I would ask them about their old devices too, okay? And provide some software bill, the SBOM, the software bill of materials, including commercial, open source, and off-the-shelf components. So, like I said, they throw in printers, they throw in this, they throw in that. That's not what they consider the device itself, but it's all part of that ecosystem. How are they supporting that? Okay. Cybersecurity vulnerabilities per year. How many keep track of any of that? Yeah, it's crazy. Look at the numbers, how they jump, and this is where we are now. Okay, so what do you think? And this is only one quarter. It's only going to get more, have more and more vulnerabilities with these devices, with different things that are coming. You got solid state stuff coming out. You got AI and everything else. People are going to use those tools that we love to help us. It helps them too. Okay, so just to be aware, it's not going to get better. It's not going to tone down. You got to be more proactive and defensive. Okay, let's talk about the insurance. Here's my predictions for insurance, and I'm only going to base these insurance based on medical insurance. We're all familiar with that, right? I know a lot of you are young, but some of you old heads, I shouldn't say old head, but people like me, remember when you could take your insurance card and then it take care of most of your care and everything else, and the world was sunny and rosy because you had medical coverage. Now you got to get people to sign off. This isn't approved because you didn't have this test done first. They kind of get real stingy with their parameters, right? Insurance companies are starting to do that on cyber. People getting hit left and right. It's costing them big bucks. So now they're going to start doing things. They're going to examine your configurations on the cloud. A lot of hospitals don't own the cloud stuff, but they have third-party companies that do. Are you asking what they do? Are they having high trust certifications to be able to secure their networks? What are they doing? What are they using? What ports are they using? You know what I mean? What are they utilizing? Not to just trust them because you have a company that does EEGs at home. They hire another company that does the cloud storing. There's so many data controllers or data owners that you don't even know where that path leads, right? So you need to know that path, because if they get hit in the cloud, who does it affect? Your customer, your business, your hospital, right? So know what those are. Okay. They're going to go after people that are low risky, less risky. How many people have car insurance? Have you ever been in neighborhoods where one place is you like your car insurance, and you go to a place like New York City, Philadelphia, other places, and your car insurance is sky high? If you have problems and if you're not showing that you're doing what you need to do, your costs are going to go up for the insurance. And that's not on IT usually handles that, but it's not just on them. We have to be proactive to make sure we're asking the right questions, because IT in general doesn't know the medical devices. They don't know the connectivity. They don't know that this CT goes to this computer and this computer or that printer or whatever else, that there's a firewall in the back. They don't know any of that. So we have to own we have to own that. We have to partner with them. And I know, don't cry, I know. I'm from the generation from the wall to the patients, to from the wall in is IT, but we can't live like that anymore. We can't be like that anymore, right? Cybersecurity is not just from the wall, this way and the wall that way. It's going to hit you coming in, period. Okay. Okay, my clicker is not working. Which way do I go? Okay, I did. Oops. Did I do that twice? Okay, maybe I have it twice. Okay, vulnerability prioritization capabilities will become critical. So they want to see what are your high, medium, low vulnerabilities? What are you doing with those, right? So some people crank out every twice a month, twice a week, once a month. You'll get a vulnerability scan. How are you handling your highs? You can't just let them sit there and look pretty. You got to have some plan to address them. Do any of you have a plan, a written plan? So if you ever get audited, how are you addressing those? Boom. I hate to go into an audit and I'm like, well, we typically do A, B, and C, and D. Not saying that you'll have one, but I would rather be prepared than not, because if you get hit, the first thing it's going to do is your leadership is going to say, so how are we handling this? What are we doing? It's a medical device. It's on you. And you say, well, we typically do A, B, and C. Well, is that written? Do all your techs do that? How are you going to answer that? If it's not written, at least know how to answer it. But remember, people move. People go different places. A director may be a director here and a director there tomorrow. It affects your program. Okay. Predictive businesses will be required to have second set of eyes. So, like I said, audits. I can see audits coming. I don't know an insurance company that doesn't have them now. Okay. So I guess I'm out of order with my numbers, but let's go to this one. Most businesses have patching strategies in place. An underwriter will look kindly upon organizations that can demonstrate that they have the right security solution in place for centralized, proactive, and defragmented monitoring. This is what I'm talking about. Okay? That's where the partnering up comes from. And I know IT thinks biomed doesn't know what they're talking about, but sometimes we gotta learn their language to shut them down. Okay? That's why I went to all these schools. Okay? So fragmented monitoring is what we do now. IT handles this part, they do the scans, then they reach out to biomed, say, hey, biomed, how you gonna address this and stuff like that. And biomed's like, what the heck you talking about? I don't know what this is about vulnerability. All I know is I got Windows 10. I don't know about this Acrobat, Adobe on here. What are you talking about? And how am I supposed to do it anyway? I can't make any changes or updates to this. I can't just push the update button because now I'm gonna wind up hurting patients, right? Defragmented means unified. I'm gonna keep it together. They need to understand us and we need to understand them. It's quicker, here's my thing, and I know I'm getting ready to go off topic. It's a whole nother conversation. It's quicker for me to train a biomed in 6 months to a year to learn and understand IT and speak their language than it is to put an IT in biomed. I would have to train an IT person for 5 years or more to understand basic biomed because they have to understand mechanics, anatomy, physiology, dealing with the nurses and stuff like that. I mean, have them work from home or in a cubby somewhere, afraid to hit the hospital floors, okay? So we need to be that voice. We've always been that voice for our equipment and for our patients. We can't shy away now. Okay, I'm trying not to run over time, but, so did that help?
So is that how you sell that to? I mean, my experience, I see all the struggles with giving biomed any type of access. So is that how you sell it to them? You say, hey, well, either you give us some access, have some stuff.
Sometimes you gotta earn stuff. Okay, you earn trust. They're not gonna just give you trust. Yes,
I was gonna ask you,
go ahead.
you don't want to step in it, you want to keep your second roles, because government IT, everything is these privileges, right? So you're never gonna give you access.
To certain, yeah.
Right, and I'm here to learn y'all side of it, right? So when I'm making these policy changes or mitigations, I can understand what you mean. You have to keep that same mindset. So when when you're approaching IT, look at it from a standpoint of, you know how the license work, and if I make this update or a software, do I increase the functionality? That's more important, because you have, it's a business at the end of the day.
Right.
So remember, administrative controls, what can I do to, or mitigate those? Keep it simple.
Right. Does that help? Thank you for your support. Appreciate that. Okay, but that's why I'm saying you need to be able to learn their language and learn where they're coming from so you know how to address them, right? So a lot of times you'll be speaking to a wall. My kid, I'll be speaking to a wall while they're grown, they're 40. I still be speaking to a wall, but I have to be where they are for them to get it, right? A little bit, and I know it's extra work, but it's worth it, right? Because we're not gonna get the keys to the castle, but at least we'll be at the table. The biggest part is we're not even at the table when we need to be, okay? And then stringent, we understand about the stringent underwriting, right? They're gonna say, yeah, we can do A, but we're not doing B, right? Other than that, then you're on your own. Increased management, okay. Results, integration of cybersecurity standards in insurance policies. Future cybersecurity insurance policies for medical devices might require compliance with specific cybersecurity standards and frameworks. This integration would ensure that hospitals are adhering to best business practices. That's coming. We already have that with Joint Commission, right? So let me just give you a thought, just out of the box. And this is just in my own head. Joint Commission is kind of directed by FDA, right? And the Department of Health, all that, right? So if the FDA is saying you're going to have to, manufacturers have to do A, B, and C, insurance companies doing that, who's going to be the watchdog for this? I won't be surprised if Joint Commission starts pulling this stuff in. I just won't, because who else? You're going to put another watchdog group in there? Why would they do that? So it's not here yet, but being proactive. You hear what I'm saying? Okay, contracts with cybersecurity components. There's a difference in scope, difference in requirements, a difference in stakeholders, expectations and accountabilities. We talked about this, talked about that, and a difference in resource competency requirements. Okay. What did it do? Someone did a cybersecurity thing on my. Thank you. Do I get to put it in picture or over there? No, over here, right? So, okay, I know cybersecurity, but not my clicker, so please excuse me. So we talked about that. Still my clicker. You got it? Can you go? Okay, we talked about that. Okay, service calls on site or remote. It's a service contract. So service calls on site or remote, you know what that means, right? We always had to do that. Are we people coming in, or do we have somebody on site that's going to handle our contracts? Scheduled preventive maintenance, we all understand that. Disposable, whether supply consumable. So we have medical devices that we don't do anything like blanket warmers. We don't do anything with them. As long as we get the supply, they give them to us, we ship it back, right? Depot on-site repairs, we handle that before. This, all the stuff that we should be familiar with as biomeds and device exchanges. Now, with cybersecurity, you have to understand vulnerability management, incident response requirements. Your manufacturers have an incident response plan to have to put together. That's been what I've been doing the past 3 years. Slow wheels get done, but August, I'll have it through. What is that incident response for their devices? Who do you contact? How have you put that in your asset management to make sure that when you have something, you can go straight to where you need to, instead of just calling your field engineer, he's got to figure it out too, okay? Because he didn't pay attention to his training. That's a whole nother thing. Now you got to think about the insurance and audibility, right? Next, please. Service contracts moving forward. Vulnerability management, are you gonna get notifications? How are you getting them? Are they emailing them to you? Who are they emailing them to? Large group, small group, one person. Make sure that you don't have a point of failure, because if that one person is not there or not in or whatever, who else gets that email, right? Patching, what is their patching policies? What are they doing? How are they doing it? Are they sending it down through the network? Are you gonna keep your device online all the time so they can send that patch when they want to? Or are you gonna force them to schedule it when you have a window open for patching, so you know when those things are being done? Maybe before certain hours, so when you come in, you're able to validate, or the technician, the hospital technician is able to validate the device before it goes back online. So how's that patching happening? Understand that. What devices are included in the digital devices? My favorite, firewalls. Are your firewalls included in this? Which they haven't been for a long time. And what are your operating system and other applications, Acrobat, Adobe, all these other things that get added and thrown into that you don't even know it's there. Incident response, define the response timeframes. What are they required to do? Can they sit a month to respond to you? Or do they have hours, a couple of days? What do they have to do? Because remember, you're sitting there twiddling your thumbs with leadership on your back because they haven't responded, okay? Because they don't know how to handle it. So what are they doing? Undocumented deliverables, additional devices, deliverables, intentional impact on analysis, an IR plan, and additional devices. And we talk about your OS. Next, please. Who picks up the tab when the device is infiltrated from remote connection? So, maybe too much. I was involved with something like that. I had to do a gap assessment between what we offered as a contract and what we could actually do. Wow, big difference. And I'm not going to say it's not, the difference wasn't on what we said we could, well, the difference on is what we said we could do. 9 out of 12, we didn't even have in place. Okay. So one of them was on the indemnity insurance, where it says that the customer, because it was a government contract, name is on that insurance policy. What policy? So nobody, but name, right? So if anything happened, what were they going to do? They're going to take a hit, right? But do they have, what are they doing as far as covering with those cybersecurity insurance? Audible vendors and remote networking compliance documentation. So fine, if they got a cloud, I want to see the certification, high trust certification on your cloud devices. How are they talking? How are they accessing? Do they have to be initiated on the customer side first? Can they just remote in, right? Through whatever port we gave them to do that? What does that look like? Please, next one. Gaps and opportunities. New contract requirements, put addendums in. I would say you already have contracts. Maybe start taking time when they're due for renewal, or even start working through chunks of them with priority. How do we put addendums on them before we renew them, right? What do we make sure that's covered that we didn't cover? Because a lot of your contracts don't cover cybersecurity, just service, right? So let's be proactive, right? Because they do it for some. Okay. Asset management. My thing with asset management is, does your database, that's always been a contingency with me at Biomed. My database, does it handle, can it handle the SBOM? Can it handle the MDS2 forms? Can it handle all these things? Can I store all these things, and are they searchable? Because I can store a PDF, but then I got to search it, pull it, the PDF, and I got to, is that data on there searchable? So here's my thought, and I asked one of the vendors, and I was like excited, too excited, but anyway, about what he said. I said, do you have, when your asset management, where if you come to and install your SBOM for that device, and they get IS saying, hey, we see this vulnerability on your device, it could be positive or not, right? It could be a fake flag. Can they then go through and compare the SBOM and say yes or no? He says, We can do that if we did A, B, C, and D. I said, oh my God, I like you. Okay, but can your database do that? Have you spoken to your provider that does your database to say that there's a need, right? Because if you're going to have to now have all this documentation, where are you going to store it? How are you going to search it? Where is that going to drive you crazy? Okay, the thought on cybersecurity medical device contract, evaluator, auditor. Who's making sure that we're on the right steps? Could it be your director? I'm sure he's got a lot of stuff to do, but does he really want to audit your contracts and make sure that we have everything in place? Maybe that may be somebody in legal that understands cybersecurity and medical devices. Maybe that may be something in your health system that you may say, hey, here's an opportunity for someone to train up to understand certain things, to whether in the legal side or on the medical side. But you're going to need somebody that's going to be able to say, okay, you're doing what you say you're doing. We're covered. We're legal. Our contracts are doing where they are. Research cybersecurity knowledge base. So who are you going to get this information from? Who are the people or the resources that you can trust to make sure that you get the latest and greatest so you're up on your cybersecurity needs? Okay, next please. So new contract requirements, contract addendums, do your healthcare system, medical devices, cybersecurity requirements, propose and negotiate the contracts. And asset management, are there enough searchable fields? We talked about that for your SBOMs, encryption, wireless details. Next, please. We talked about the database, right? So we can go past that one. Cybersecurity contracts and evaluator, who reviews? We talked about that. Resource knowledge. Who knows your cybersecurity? Who knows the industry requirements and standards, right? Who knows the configurations? So you have a radiology device, a CT. How many people, because this is what I had to do in cybersecurity for my health system, I had to diagram my CT, what computers are connected to that, right? What ports they're connected to in the closets, right? The whole 9 yards. I had to do workflow diagrams and actual diagrams for them. Do we do that? Do we have that? So if something's on, do we know what cord to pull? Just because you pull one in the CT room doesn't stop all the other stuff, right? And do you have it labeled and tagged, right? So the hospital that I worked at, we have our own clinical engineering closets, right? Everything is all on the clinical side. They have a cybersecurity hit. They were able to, what we did was green tag everything that was connected to the hospital backbone, right? So when they got hit, we pulled every green one that was labeled. So it didn't affect our patient monitoring or anything else. Everything on the medical side was still running up and running. They had to deal with on the other side. So we didn't affect patient care. Yes.
So you're saying you cut off
From the health, yeah, from the hospital.
drop services?
No, because we had our own infrastructure.
Oh, so y'all trying to do, y'all want to
Yeah. That's why I said, if you ever want to have a conversation with anybody, at Atlantic Health, that's what they do. Great job. Legal contracts with cybersecurity requirements. Next, please. Healthcare mindset. Everybody talks about cybersecurity, which is integrity, confidentiality, and availability. But you know we're all about patient care, right? That's at the core of what we do. Possible next steps, identify your medical devices, cybersecurity resources. Talk about biomed, IT, legal. Have a conversation. Let's talk about this. How do we make sure we're covered? Let's come up with some standard documentation that we're going to give as we move forward to our vendors, right? So they know what they have to do and they can tell us, yes, they can do it, no, they can't do that and stuff. But at least you'll know, right? Develop a list of cybersecurity deliverables that the health system would want to have included in your purchases and your contracts. So your CT unit is under contract. I want to make sure my firewalls are not only patched and upgraded, but if my firewall is no longer supported, you're going to replace it. Okay? Because that's part of the ecosystem. Like I said before, it wasn't. So I would go with the list of things I must have, and then the things I'd like to have. They don't need to know the difference in the list, they just need the list. You know the difference in the list. Next, please. Review all purchases and service contracts upcoming for the renewal and incorporating any cybersecurity deliverables that you don't already have, that you don't have. Submit the request to cybersecurity requirements to be added The purchase agreements and service contracts. Things are negotiable, but as long as you know what you're negotiating, you know how to protect it on your side, right? That's what you don't know, is what you get hit with. Any questions? Yes.